Please. Alright, I'm gonna go get your stuff.
Okay, thank you. Is January 20th, 5 after the hour here, 9:05. I will call a regular meeting of Dolores County Board of County Commissioners to order. If everyone can join me in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, liberty and justice for all.
So, few additions under the new business. First on the new business, we have the reconsideration of possible adoption of the procurement policy for social services. With that, we will add consideration and possible adoption of the Dolores County Senior Services Title VI plan. If you guys are good with that, you add into new business.
Point of clarification on that. I think we've been referring to it as the senior center procurement policy. In fact, that's my understanding that it's the county procurement policy, and then senior center needs it updated to satisfy their requirements.
Okay, perfect.
Make a motion to approve the agenda for January 20th, 2026 with the amendments added to.
I'll second that motion.
So I have a motion and a second. More discussion. We also need to add our road inventory approval. So we could modify our motion to. Oh, you're good. You're good. If we could, I would ask that we modify motion.
Raise my first motion, and I'll make a motion to approve the agenda for January 20th, 2026 as amended, titled Sixth Plan and Road Inventory.
A motion from Commissioner Yellowman to adopt budget with the addition of Dolores County Title VI plan. Motion was amended to also include the road inventory update. Do I have a second?
Second that motion.
A motion and a second. All in favor of adding our two agendas?
Yes.
I'm a yes as well, and we'll put both of those in new business. And do you all have any questions on expenditures and see any come in this week? I didn't see anything from last week to.
I'm sure she's got one.
Step over to our minutes. We have minutes from the regular meeting on December 8th, 2025, December 15th, 2025, and then special meeting minutes, December 22nd, 2020.
I make a motion we approve the minutes for December 8th, 2025, December 15th, 2025, December 22nd, 2025, special meeting minutes. As amended.
And I'll second that motion.
A motion from Commissioner Yellowman to approve December 8th regular meeting minutes, December 15th regular meeting minutes, and December 22nd special meeting minutes. All in favor of approving minutes as presented?
Yes. Yes.
Yes as well. Right. See what expenditures in and the ones on the table to have a chance to review. Do you guys have a problem with that? If we have expenditures, lay them on the table until we can review them. Okay. Let's see, we have a full vote online today. Public comment will limit to 5 minutes per speaker, and with what we have for reorganization today, we'll hold to that fairly strict.
Oh,
Perfect. Well, we've laid that on the table until we get a chance to review those. All right, moving into our 2026 reorganization. I don't believe it's been a year since we were.
Sorry,
doing
Mr.
this.
Chair. Public comment, is that, where we can read the letter that I sent you guys yesterday, or is that gonna happen? Closer to the ground maintenance licensing that's on the agenda?
So as we get into that agenda, and it's pertaining to agenda item 1030.
Yes, sir.
Okay, so we can address it then.
Thank you. Sorry.
Dick, when you see public comment, it just means all the other items that we
Okay.
have 5 minutes for.
Okay, thank you.
It's not right there.
Okay.
Hi, good morning. Hi, this is Fred calling from, getting on here from Durango. I just wanted to say good morning and introduce myself. I am the Executive Director for Southwest RETAC. And I just wanted to let you know that I'm here in support and appreciate the opportunity to learn more about the situation as I've become aware of some challenges between Dolores County Ambulance and dispatch situations. And so I'm interested in learning more and hope I can be of assistance moving forward.
Perfect, thank you. We will be getting into that at 10:30. So thank you for being here.
Sounds good.
Okay, moving to our Board County Commissioners Board reorganization.
So, commissioners,
Yes, that is just for us to establish a chair and vice chair.
we make a motion that chair and vice chair and continue as it is.
Okay. Have a motion from Commissioner Yellman to retain Commissioner Stiapi as chair and Commissioner Yellman as vice chair.
and I will second that motion.
Have a motion and a second to retain Commissioner Stiapi as chair, Commissioner Yellman as vice chair. Is there any other discussion? All in favor?
Yes.
And I'm a yes as well. So, and second piece of our reorganization, employees.
We need to do the courthouse hours, holidays and.
Yeah, we'll look at them, we'll address employees first.
Oh, I'm sorry.
And then, yeah.
I have to look at it and not have any questions on anything.
I have one question. You discussed the Cook County newspaper, our local newspaper, we cannot do that yet.
Oh, no, we can visit about that, as we work down to the designation.
Okay.
For employees, I make a motion to approve, our employee list as presented in our reorganization packet.
I'll second the motion.
I have a motion and a second to approve and retain employees as presented in our 2026 reorganization. All in favor?
Yes.
Yes, as well. Courthouse hours, holidays, and meeting dates. Currently Monday through Thursday, closed Fridays. I know this. speaking with people last year, the fifth day being closed was something that people would like to see. And have discussed it at length with our elected officials here. The direction we're moving and seeing a large reduction in our revenues and not really a plan to counteract that right now. I like sticking with the Mondays and Thursdays until we can supplement our revenue.
Okay.
Just to keep the building the way it is. Days,
Make a motion that we keep courthouse hours, holidays and meeting dates as they are.
I'll second that motion.
motion from Commissioner Yolanda to retain our courthouse hours, holidays and meeting dates. Presented 2026 reorganization. Is there any other discussion?
I have none.
All in favor?
Yes.
Yes.
Yes, as well. The designation of county newspaper. So currently the Journal, Cortez Journal is a designated county newspaper. The only thing that would potentially change this is there's a legislative proposal out of Eagle County. And it looks like it is going to clear in this legislative session that will allow our local governments, Dolores County, to publish our legal notices in non-periodical. For example, there's a non-periodical, we have two here, the Pennsylvania and the Orchard. We will be able to publish legal notices in those two.
If it passes.
If it passes. And everything I'm hearing right now with CCI, I think it cleared the last hurdle with the Press Association. So I would expect that to come this year.
Was there any attempt to introduce a bill to look back at getting rid of the newspaper publication altogether and allow just online publishing?
They talked about online publication. I don't think we're there yet.
That's a shame.
Yeah. Yeah, in the meantime, still gonna be required for print, but I would suspect that we will see it move to just an online posting.
And I haven't looked at the legislation yet, but the one thing that would concern me would be, number one, the cost associated with it, because the publication cost is really high. And it's a windfall for these newspapers, and I'm wondering if they're carrying that over to these periodicals who might not have a lot of income, and then suddenly we'll have a lot of income.
Yeah,
That would be a concern. And then the other concern I have is throughout the statutes, there are numerous places where counties are required to advertise for various different things. And they will call out in a publication of general circulation within the county, things like that. I'm wondering if they're gonna go back and remove all references to that. Because that's gonna be quite an amendment to a lot of different statutes if they do that.
yeah,
I'll take that.
perfect.
You don't have a bill number, do you? On that one?
I don't know if they've pulled
It's so much easier if they would just allow online publication.
What would there be the reason not to, I wonder?
Newspaper lobby,
Oh,
it's a lot of money. And the amount of money that we pay the Cortez newspaper
which is a
to
lot.
publish the monthly warrants and all that stuff. It's really, really crazy. Oh, look,
Hey, I don't see a bill number that's been put out by CCI. I'm not saying the one that hasn't been pulled, but it's presented.
I'll look there. Excuse me.
Perfect. So in the meantime,
David Journal.
I would make a motion that we designate the Cortez Journal as our county newspaper.
Second.
I have a motion and a second. Any other discussion?
No.
Favor?
Yes.
Yes.
This as well. Our county boards.
That's a lot of boards. There's so many boards.
Are we doing it all individually or do we do it in?
We'll do it all together. So our county boards, we have Fair Board, Weed Control District Advisory Board, Planning Commission, Town of Rico Boards and Manager, Emergency Medical Council, Dolores County Public Library, Senior Services Advisory Board, West Dolores Cemetery, Cajon Cemetery, Rico Cemetery, Lodging Tax Board. And I'll make a motion to approve the boards listed in our 2026 organization.
Motion.
A motion and a second. Any other discussion?
I don't have to be.
All in favor?
Yes.
Yes.
For county boards obtained. And here is our. Have any cause for concern with our weed district plans?
I don't have any questions at all. It looks good. I make a motion, we approve the weed district areas of operation.
Have a motion and I'll second that. I'm sorry. A motion and a second to approve the weed district area of operation as presented.
Second motion.
Could I put some clarification on the record? I do this every year because it's just so complicated. You've got the mandatory weed district, which is actually pest control district, which has its own district board. And then you are approving their district weed plan. And then you're also recognizing and reappointing the pest control or mandatory weed district board as your countywide weed advisory board, and also adopting and accepting their countywide weed plan. And we do that every year, and it's a mouthful, and
Thank you.
that's technically what you're doing by approving that, and just
So
as a reminder.
perfect. We have the motion to approve the weed district wide management plan and the county-wide weed management plan, as well as our weed. Right?
Yes.
Yeah, I say it every year because it took so long to wrap my brain around it early on that I like to remind everyone what it is.
Okay. Have a motion and a second. All in favor?
Yes.
Yes.
Yes, as well. Thank you, Dennis.
You're welcome. Yeah.
And our health medical officer and AED consultant. Patrick Posner.
I didn't see one.
We,
Was the addition with the AED consultant for Dr. Posner?
correct. So I was hoping to have that back. We didn't get that back from,
have not seen it.
did the board see that contract yet?
I think
Was the AED?
So I think, because we're currently under a contract with Dr. Posner right now, because it automatically renewals each year under the old contract. This year, we're planning on adding Dr. Posner into the contract as the IED or AED consultant. And so that contract is out there being reviewed by Dr. Posner. I think you guys are fine to reappoint him as the medical officer, just realizing that we're gonna be seeing a contract shortly, but I don't think it affects your.
Okay. We'll make a motion to appoint Dr. Posner as the Dolores County Medical Officer and AED consultant.
I'll second that motion.
Any other discussion?
None for me.
All in favor?
Yes.
Yes, as well. Commission liaison to departments.
I'm comfortable with what I'm doing.
Yeah. Workshop that out, was able to better, sign up for what our time would allow. And.
Let's see what you have.
Yes,
Eric, you might read these out loud, so
Yeah.
everybody knows who's doing what.
Our liaison to departments, Road and Bridge, Phyllis Davis, address and mapping, Eric Stiasny, addressing and Stiasny. Emergency management will be Phyllis Davis, Dolores County Social Services, Lindy Elliman, Public Lands, Eric Stiasny, Economic Development, Phyllis Davis, Courthouse Maintenance, Phyllis Davis, Senior Services and Public Transportation, Lindy Elliman, and Public Health, Lindy Elliman. So, and I see a lot of our department heads, elected officials on, so, this will be going out, so you guys will have a document for this. Make a motion to approve our commissioner liaison to departments as presented in the 2026 reorganization.
Second motion.
Motion and a second, all in favor?
Yes.
Yes, as well. Active boards, representatives. Senior Services Board, Lindy Elman, Region 9, Lindy Elman. Or a Dolores Water State Collaborative, Eric Stiasny, AAA, Lindy Elman. One change here will be TPR. I will take that from last year. Linda had that. Aligns closely with CDOT, so I'll take CDOT as well. Housing Solutions, Commissioner Davis, the Lower Dolores River NCA will be all three. Co-chair County Coalition of Sage Grouse, all three commissioners. Sage Grouse Advisory Board, all three. Executive Council of Sage Grouse, all three. Club 20 will be Commissioner Davis. Colorado Council Incorporated, CCI, I will retain that, as well as the Southwest Opioid Response District SWORD, the Martin Lowers Coalition, and our BLM and Resource Advisor.
I'll make a motion.
Have a motion from Commissioner Elman to appoint our commissioner representatives to the aforementioned units.
I'll second that motion.
All in favor?
Yes.
Yes, as well. Shayla, I will snag a new copy of that reorganization to sign because I marked up
Yeah.
that one, so we
Okay.
can do that later.
Okay.
Okay, new business. Stephanians will have our reconsideration of possible adoption of the procurement policy. It is resolution number 1-26. Zero.
So it's my understanding that, so this procurement policy was adopted in 16.
Yeah.
And 2016 and basically sets forth different stages for. Basically the county procuring, the goods and services, has some exceptions in there. It also has quite a bit of latitude. Personally, I think it's worked out well for the county. By statute, there actually is not a requirement for a county to have a procurement policy at all. And until 2016, we did not have one. It wasn't until, grant requirements, federal grant requirements and certain state grant requirements dictated that we adopted the procurement policy, official procurement policy. Policy gives a lot of latitude to the board to opt out of the policy when not appropriate, given the lack of services and things like that offered in our area. Also provides a local preference for certain activities. And oftentimes we see the procurement policy not being applicable because there's only one provider in the area. It has worked out well, in my opinion, since 2016 adoption. And it's my understanding that Lisa, Senior Services Department Head, needs readoption in order to satisfy federal requirements, probably regarding transportation. So what I did is I just simply did a readoption, and this is the old one.
Yeah, it's cell phone.
Okay. I just did a readoption and clearly labeled it without amendment. And that's it.
We'll make a motion to approve resolution number 1-26-01, readoption of Orange County procurement policy. Motion and a second. Any other discussion?
None for me.
All in favor?
Yes.
And stepping into our added agenda item, will be the Dolores County Senior Services Title VI plan. See, Lisa, thank you for the work you put into that. That's very strong document. So thank you. Anything on your end with it, Dennis, that you've seen?
No, I just thought it was, as I commented previously, I thought it was very well drafted, very well put together, which is typical for Lisa. And I didn't see a problem with it. If that's what we need to satisfy her federal requirements, it looked like it was very well done. So no problems.
I will make a motion to adopt the Dolores County Title VI plan for senior services.
Okay.
A motion and a second. All in favor?
Yes. Yes.
Okay, next item of new business. Hiring of our new public health administrator. We got to interviews last week. Together. I'll make a motion to hire Julie Keibel as our new public health administrator.
I will second the motion.
Have a motion and a second. Any other discussion? All in favor?
Yes.
Yes as well. Well, welcome aboard. Welcome, Julie. And speak about this position, we are in the workings of an IGA with Montezuma County to take on the executive public health director role. So with them taking on the director role, this is a new position created within public health for efficiency and blending roles out there. So thank you, Julie. And some annual treasury reports.
She's coming around the corner.
Oh, all righty.
Taylor said she's gonna come down. She's somewhere else. Okay.
I was like, oh, I'll just sneak in the back.
But you're up.
But I'm up. Good morning, guys.
Hey, how's it going?
Good, how are you?
Good.
All right. I'm here for some things. I got you some things,
Perfect.
not a bunch, but just a couple. Do you guys want the littler ones? I printed big ones for signatures, but you probably don't want that on your desk.
Drown.
So these are December of last year, just for comparison, if you guys want to look at them. And kind of see what December of last year semi looked like. I'm sorry, I was gonna get a bunch of numbers together.
I think they're gonna take them.
Here's this year. They're tiny. So if you wanna look at the bigger one, let me know.
If there was some of us.
Right, I should have brought rulers. Trying to follow the lines. So last year to this year, we're 288,000 less in the general fund, and actually our bottom line is only like $500 different from last year 24 ending period July through December to this year. So that's not horrible.
General's down 280.
Yes, sir. Yeah, 288,000. So that was kind of my big comparison from last year to this year. And the bottom line is that difference as well, minus the $500. I haven't found where that was yet.
Could I ask a question?
Yeah.
So if general's down 288, what was the total tax income down? I mean, if we were impacted, I mean, how was the school impacted and all?
All the different entities.
Yeah.
Um,
What was the total downsize of the?
I have to do the math here, Dennis. Looking at current taxes and interest, we went from, actually December of last year, we were at 230,000 collection, and this year we were at 277,000. So we actually did better as far as current collection this year than last December. But that could just be people paying and things like that. This doesn't break down the actual revenues or like
Oh, I was
what we
just-
were supposed to collect. That's just what we collected.
No, I just meant overall with all the taxing entities, what was the total number? How was it down?
How
If you don't have it, please
I
don't.
don't have that with me right now.
Last year.
Oh, did you want a copy of this, Dennis?
Well, 24, it says.
Whenever, like busy right now, but whenever you do catch your breath, if you just shoot that out to an email.
Okay.
Um,
The tax collection.
Yeah.
24 versus this year.
Yeah.
And there's probably a big difference with the SRS money coming in.
yeah, that'll help being back paid for 25 now, 627.
I didn't mean to throw you that curveball right now.
No, that's okay.
Sorry.
No, like I said, I was a little unprepared with numbers. We've been so focused with trying to get our tax roll. It's been a little bit of a hectic mess in my office, so. I appreciate you asking. I will find that information and get an email sent. You have any other questions that I can look into for you guys or any information or? And if you guys wanna hold on to them and look at them, and then if you have questions later. Absolutely, feel free to ask and come up and see me and. I can dig.
Yeah, I don't know. Oh, go ahead, sorry.
I mean, I would rather look at it and then, you know.
Right,
Mhm.
have some time to kind of look at the numbers between last year and this year.
Make it on this.
Yeah.
Yeah, I don't know if I have any questions, I mean, really pertain to this, but from this, I guess, so.
And I need a chance to look through everything and compare notes.
Yeah.
Understand.
Okay. Yeah, so I'll make a motion to set the semi-annual trips report.
Yeah, you guys had reorganization this morning. Did you guys approve what paper we're going through? Yes, those big. Okay,
Yeah, there is the legislative proposal to go to non-periodicals.
okay. But it's not approved yet, so.
That'll have to go through this legislative session.
Okay.
Do they work for you well? The general? Do you have
Oh,
any
yeah,
problems? Okay.
no, they do really good. They're just, I mean, expensive.
Expensive.
Yeah, that's the only thing. And I have a really good contact.
ones.
Yeah. I have a really good contact and she's great. I've already sent my semi-annual and she's waiting for signatures and approval and. I've got some other things going on. I have another foreclosure going in the next couple of weeks, and so we're working on that, so. I've got some good contacts. As far as working with them, they've been great, excellent. I just wanted to make sure I get it put where it needs to go. Yeah.
Yeah.
So. Then I just realized I did not bring my depositories. I try not with me.
I have one.
You do?
I gave it, yeah, there's one in your signature,
Oh,
file, Eric.
Perfect.
thanks. I had it printed out and I had my sister read it this morning and did not bring that down.
You need to look at it, Taylor.
No, I don't think so. Everything is staying the same as last year. Moving forward, if I have changes, I'll let you know, but as of right now, we're just gonna stay the same with the banks that we currently have from last year. So we have community banks, we have Dolores State Bank, Follow Trust and Safe.
Do you have a motion right now, to approve the semi-annual trips report?
Oh,
Have a
sorry.
second, any other discussion?
None for me,
All in favor?
yes.
I'm a yes as well.
Thanks, guys. I jumped you ahead.
Resolution number 01-26-02, resolution approving the bank's Ford County deposits. So.
There we go. Now.
Perfect. Community banks, Florida State Bank, Call Trust, CCA, just.
Make a motion, we approve resolution 126-2, a resolution approving banks for county deposits.
A motion from Commissioner Yeoman to approve resolution number 01-26-02, a resolution approving the bank's Ford County deposits.
I'll second that motion.
Motion and a second. All in favor?
Yes.
Yes, as well.
Thank you, Patty.
Thank you.
Now can we just get a lot of signatures? And if you want, actually, you can probably just sign the big ones for me and then, and maybe one small one. And then keep the rest of my records.
Perfect, and we'll get these out to you.
Okay. Can I leave them here for your signatures?
Totally.
Okay, all right. Thank you guys. Appreciate it. Well,
One investor, but
I don't know, I don't know. I don't think they'd have time.
do you guys want to do road inventory? I'll get Amber to come over.
Oh, yep.
We want to do that
Perfect.
before the 10.
Yeah, perfect. So we have State Line Bar and Grill liquor license renewal. Don't believe we've had any concerns raised by Sheriff Wilson with the adoption of renewal for the liquor license. Changing on this, see, payments in. I'll make a motion to approve the State Line Bar and Grill liquor license renewal.
Second the motion,
A motion and a second. Any other discussion?
none for me,
All in favor?
yes.
Yes. Yes, as well, the State Line Bar and Grill liquor license renewal is. Amber, at previous meeting, we had approved the Sidwell GIS contract, which just have a correction with the total on that. You know the change off the top of your head? If not,
Is she still on?
I thought I saw it.
She was.
Oh, there she is.
I have the will you go back.
Perfect, thank you. Yeah, looking, it looks like it was a year two total discrepancy. With a difference, an increase of $2,010. For the year two. So the actual amount will be $59,892.
Yeah.
And you need this back.
I can get it in a little bit.
Okay, perfect. I'll sign it.
Okay,
Or give it back
thank
to you.
you.
I make a motion to approve the Sidwell GIS contract with corrections in the to $49,882.
Second motion,
Motion and a second. Any other discussion?
no,
All in favor?
yes.
Yes. Yes, that's what-
Amber's on her way.
Perfect.
And so Julie said she did try to respond and say thank you. She cannot, and it won't let her send a chat either, so Dennis was correct, and I don't know what's wrong with it. But we know some people were able to talk, so
Yeah.
anyways, she said thank you very much.
Oh, we're gonna think about it.
And so did Lisa. Lisa said thank you very much too.
Yeah, shoot.
So I guess right after we
Yeah,
get to
we
executive
felt
session,
review.
I have to tell them all
All
of
the
the
agenda item was the road inventory. And so we've been updated with our HUTF revenues, you know, what that road inventory looked like, so.
Good. Yours on there as you always are? Yes. I know. Ellen.
Remember.
Signaling.
Just sort of be good.
Good.
Yeah.
We said, very much.
Yeah.
Perfect. And yeah, we,
You, that now?
yep, added you guys on to new business. Yeah.
So this is the final report for the inventory. And all of those roads, I went in to update the year of improvement and the conditions are good. So that's all we did. Okay,
Perfect. So no changes,
no
So you
changes
talked
from
about
last year on the length of the inventory,
I
so.
was gonna say last week.
Yeah,
We talked about-
that's great.
Thursday.
No.
Thursday.
Yeah.
Every day was, yeah.
Oh, good.
So if you guys agree with it, what needs to happen is all you guys sign it and then Steve signs it. Then I'll submit it.
Thank you, member. Make a motion to approve the Dolores County Road inventory for the Colorado Department of Transportation.
Second that motion.
A motion and a second. Any other discussion? All in favor?
Yes. Yes.
Yes, as well. Thank you guys for coming up.
Yeah, no
For
problem.
that.
Steve, you need to sign it
If I could sign this and then I could get it to you guys
this afternoon.
this afternoon.
Yeah.
Yeah,
That'll work.
Perfect.
Thank you.
Thank you. our little schedule. I'm gonna make a motion to go into a recess until 10 o'clock. And then we'll reconvene for the budget items. Have a motion,
Make a motion.
or is there a second? We have a-
I'll second.
Yeah, a motion and a second to take a 10-minute recess. All in favor?
Yeah.
And this is well, we will recess until 10 o'clock. There's hot coffee.
Okay.
Good. All right, so we are out of executive session. And we'll move into our third agenda item here is 11 o'clock. Consideration of possible action regarding adoption of county ambulance licensing requirements to manage the usage of local dispatch services, and believe had public comment. And Damian, you were up first.
The only comment really I have is just request that you read that letter that was sent to you guys, and if you don't have it, I can pull it up and read it.
Okay.
Right here.
Yeah.
Did you read the 46 pages he sent you?
Linda has one too. So. Let's see. From that.
So. I don't know if I'm supposed to say per se, but
Either.
So I'm Damian, Chief of VMS for Duck Creek Ambulance. I'm writing in my capacity as Chief of VMS for the Duck Creek Ambulance District regarding today's board meeting scheduled today. Attached to this letter of documents intended to provide factual background, context, and documentation related to ongoing communications and operational concerns involving emergency communications and dispatch services affecting DCAD. I respectfully request that these materials be read and reviewed by the board prior to the meeting, and that this letter be read into the official record of the meeting as formal communication related to that meeting. Purpose of the attached documents. The attached timeline and supporting materials summarize communications, documented incidents, and operational concerns spanning from November 2024 through January 2026. These records were prepared for transparency, accountability, and institutional memory. They are not grievance documents, rather they are professional documentation intended to support informed discussion, risk awareness, and thoughtful decision-making. In brief, the materials outline recurring themes that have prompted review and fact-finding, including dispatch coverage changes occurring without notification to field units, delayed or missing pages, inaccurate or incomplete location and call information, difficulty obtaining CAD documentation when concerns were raised, increasing strain on interagency coordination and trust. These concerns have been documented over time through emails, provider reports, and formal correspondence, and escalation to broader review has occurred only after repeated efforts to seek clarification, collaboration, and corrective action. Clarification regarding current DCAD actions. It's important to clearly state that the Duck Creek Ambulance District Board of Directors has not taken a formal vote to change dispatch services. The request for proposal distributed by DCAD was part of the board's fact-finding effort to better understand the services currently being provided and the regional options available. Statements circulating within the county suggesting that DCAD has already made a decision regarding dispatch services are inaccurate. DCAD has arrived at this point only after a prolonged pattern of concerns, documented incidents, and unsuccessful attempts to resolve issues through routine communication. The intent has consistently been to gather sufficient information to allow for responsible, informed governance decisions. Countywide impact and the need for broader consideration. Recent discussion regarding potential ground ambulance licensing requirements would not impact DCAD alone. Agencies such as Rico Volunteer Fire Protection District, West Fork Fire Protection District, and Southwest Health System EMS also provide essential transport emergency services within Dolores County. Any county level decision in this area will affect the entire emergency medical system serving residents and visitors. For this reason, I respectfully request that the board consider the broader system implications and compile data regarding the number of transports conducted annually within the county by each affected agency. Accurate data will be critical to understanding operational realities and ensuring that any future decisions are equitable and informed and grounded in best practices. Additionally, I ask that decisions of this magnitude not be made in a manner that disproportionately impacts one district without the same level of communication, review, and consideration that the board has appropriately requested of DCAD through this process. For transparency and public awareness, the DCAD Board of Directors will hold a scheduled meeting on January 21st at 17:30 hours, located at our ambulance barn on Guy Main Street. And then a public workshop will be held on February 4th at 1800 hours. No formal action regarding dispatch services has been taken to date, and any future action will occur through a public board process. My intent in providing these materials is to support open communication, accurate understanding, and thoughtful discussion across all involved entities. I appreciate your time, your service to this community, and your willingness to review this information.
So I've got a question. I mean, we received the bulk documents last night at 8 o'clock. We'd also requested a workshop with the ambulance districts. Sorry, why did I receive this at 8 o'clock last night with no real opportunity to review these documents? And why I wasn't,
50-some pages of it last night about 10 o'clock.
So, I know that the county commissioners requested the workshop. We worked to schedule a workshop with all parties involved. And that's the workshop that's scheduled for February 4th.
because I mean, the response we were given is you can attend on a regular board on the 21st.
Exactly, I did that.
Mhm.
And that's true. How many times have you been to our board meetings?
I haven't been to a single one of the board
I know.
meetings. But if there's an issue and we request a workshop and you have apparently bulk documents that they're going into. I'm just, I mean, you say respectfully request that it's reviewed. I don't feel any respect in it coming in late at night.
Hey,
I've had those documents for about 3 days.
I spent 3 days compiling all this information for the request of my board. I didn't get it sent out until Saturday night to them. And then Sunday morning, it had been midnight. And it wasn't until multiple board members had contacted me requesting that I sent you those documents.
Can I speak a little bit, Chair? There were some inaccuracies in that. More than one or two
And what goes?
in those documents.
What is it?
As a dispatch for 30-some years, there was inaccuracies stated in there.
There are did you read the 46
Not yet.
pages of stuff?
Yeah. I
And
didn't say
that's-
much last night.
Verbatim. I mean, that's word for word, because most of them are recorded.
I was still there in 2024 and there was inaccuracies. I was head dispatcher. in
Did you
2024.
highlight them so that we can discuss
No.
them, or you're just gonna talk about it?
No, I just wanted to say that there was inaccuracies.
There's inaccuracies on
I can
both
highlight them.
parts, I think. Yeah, if you
Yeah,
could please.
there was some.
So when we have our February 4th meeting, we can actually sit down and discuss this stuff
Okay.
without having this showed at us.
Okay.
You sit there grinning, Eric.
Is there any other public comment?
Yeah, I'm gonna continue talking.
Okay, yeah.
At the last
Let's
meeting
start that.
that you had, I wasn't here because Robin was having an infusion. we made the mention that you felt like there had been embezzlement. Yeah, or
No.
misappropriation of funds.
Misappropriation of funds.
And I just
Exactly.
wondered where you got that information, because our books are open, just like yours. You can go in and look at it anytime you want to.
Did not make. I would love to approve
I've had several people ask me
It was,
that.
it was actually the county attorney that made the comment of,
Started it
you need to be careful.
because of embezzlement and all this stuff, and it could be looked at and blah, blah, blah. He was just giving advisement.
I was giving
Well-
advice for you guys to hire an attorney. And to stay with the Special District Association, read the manual. These things are very difficult. You wanna make sure that you have preventive measures in place for things like misappropriation or embezzlement. It's the same advice I would give to anyone. So no one accused anyone on your board or on the district of any kind of misappropriation of funds or embezzlement, none. So that was me referencing you guys, you should have an attorney to help you walk through these processes. You have a budget each year, you have an audit process. And it's important that you make sure that you're following all the rules so that you never run into problems like that. So.
And that's appreciated. Because it is very hard to find a liar. And because of the fact that we haven't had any money for so long, it's also very expensive.
It is, but it's well worth the money to get somebody that you can call and ask advice from. And the Special District Association is just something that, I mean, I look at their stuff all the time when I have to, even for county stuff. They have very good attorneys that talk about board actions and financial things, so.
We actually had an attorney that the town loaned us for a while, Mr. Michael Green, and he walked in one day at the town and quit, and therefore we lost our attorney as well, so, because he was doing it in favor for the town, so. I just feel like I really don't know what's going on here for sure. There's some underlayment stuff, and I know it partly started with the dispatching stuff. I do know how stubborn everybody is. I'm one of them. I want to know what this is really all about. What are you planning on doing? Why are we having this meeting?
I mean, I don't think there's a plan for anything right now. I mean, this was brought up after we weren't able to hold a workshop with the ambulance district. And we received a request for proposal to change dispatch centers. That in conjunction with October, receiving a letter from DOLA that our ambulance was at risk, our ambulance district was at risk of dissolution. I mean, raises some pretty big flags.
Did you know anything about that?
I did when DOLA sent me a
Yeah.
letter.
Us too.
Yeah.
I asked Loretta about it. She didn't even know anything about all this, and that actually went into effect in 2018. I had no clue.
Well, who gets that paper?
I really don't know, because we didn't. I looked through
Somebody had to
everything,
have
and
it
that's
somewhere.
not a thing.
And it was something just as simple as, and I was on Anna's board, we didn't cancel the election and nobody knew you had to cancel,
We,
correct?
we had to have an election, number one,
Yeah.
or cancel there, because I am the only last actual voted in member to the ambulance board. Because of all the turnover we've had and people sick and people dying and whatnot, we just,
Oh, yeah, but I think, and I was on the board then, so we just didn't know that you had to. And we've never received anything in the mail that you, Joyce, that I've ever read, or even Lenore hadn't either on that.
But there has been yes, there was a proposal put out, but we have not made any decisions about the dispatching system. We would love to be able to stay here, and it was mentioned, Damien mentioned getting everybody EMD trained. And that was like, whoa, a bomb went off. I think that's a good idea. I spent 36 years on this ambulance in one place or another. And I look forward to education, and it would do the county great service to have EMD trained dispatchers on.
You can have that, but you have to have two dispatchers 24/7. You have to have a 24-hour, 24/7 EMD You have to have 2 dispatchers working 24 hours a day. That's
Well,
double.
is that a problem?
I think financially, it's a big problem.
What if
That
somebody,
not only means 2 dispatchers, then you have to have another officer involved. Because once you start EMD, you cannot stop till that. Damien can back me up on this. You cannot stop that call until emergency services arrives.
well, you shouldn't be getting that.
No, you should. So
There-
you have to have another dispatcher and they can't answer the phone. They cannot do anything but EMD. I took a class in those years and years ago.
I think what the ambulance, if you don't mind me saying.
So I'm sorry.
No, that's all right. I think the ambulance is saying they are willing to explore different options that might improve the dispatch system locally.
Right, we've been after
And,
this for a long time.
And whatever those options are, sounds like they're likely gonna explore them and are willing to explore them, which was a good thing.
I mean, is the breakdown with communication and the Emergency Services Council?
There is no council.
Okay, so there's a problem.
There's one person running the council and we don't have meetings. I get a phone call that says, what would you like? Oh, with the RETAC funding that's given to the county. But on a flip side, I don't really know how that council would have helped specifically in this situation.
Well, I mean, a council convened of our local EMS providers working under a unified command structure and dispatch is probably the best practice.
Agreed. And in addition, I requested that a council be looked at and that documentation be drawn up so that we have a council. And I'm pretty sure you told me that's extra work for what we're looking for. And that was when the last set of funds commissioners were here.
For the RETAC distribution of funds, I think is what there was. So there was a big discussion and there's been an ongoing, there's an ongoing issue with the RETAC funds allegedly not being distributed fairly amongst the emergency services provider. And Damien came forward and said he wanted to participate fully in those RETAC grant fund distribution discussions. And that's when I think he first started putting the meetings together and saying, okay, I'll talk to you guys and we'll meet and we'll talk about it. And I think you did ask at that time that that there be additional work done in those emergency council, emergency services council things. So I think but today I think that's a good idea.
Is that what?
Yeah, technically, if I can hop in, technically, we've never really had anything formalized. I would meet with Rico and the chief, whoever it was at the time, to find out what people were wanting or needing, whatever, with to do with RETAC funds. We've never had like a council or a emergency services group whose sole intention is to meet with good faith to make a better response system for Dolores County. And it would be a place for agencies to have redress if things weren't working correctly, and a way to fix issues before they become major. And I would love to move forward with that.
I don't feel like we're being treated very fairly here because Phyllis was with dispatch for so many years. She's tending to go that way by what she just said.
I was also on the board, Joyce, which I
know.
I love
but-
ambulance, yes.
I know. But I don't feel like you guys are treating us fairly, I'm sorry.
Is there any other comment?
Sorry, just a question. Currently on the website, the Dolores County website, there are only 3 entities that are listed under your EMS council. That is the ambulance, Riga Fire, and the emergency manager. So if this is what the EMS council is comprised of, you're still not getting a representation from the sheriff's office or dispatch. Or other agencies like, Duck Creek Fire, Pleasant View Fire, who responds in this county and part of their district is this county. Or West Fork Fire, who also operates EMS on the Dutton West Fork side.
Any other comment?
I would just like to feel like we're being heard and not in a formal meeting like a workshop. And the reason we didn't jump on the workshop that you had, it didn't work for any of us. I couldn't be there because I was in junction with Robin. Shauna wasn't feeling well. I mean, we all had reasons, and that's why we put it to the 4th of February. I didn't realize that you had to be the one that set the meeting date, and that's the one we had to follow. I thought we could do it as well, so.
Also, it needs to be noted, the board is not paid. We are not paid. We volunteer our time. And I know with as a nurse and being in healthcare my entire life, patient outcomes and employee safety are my concerns. Period. Period. And if people can't come together in this community, I've never seen anything like this. And I am so upset. My dad would be rolling over in his grave. If you can't come together as a community, I don't care what you think of me. And you probably don't care what I think of you. But if we can't, oh, I do know, but if we can't sit at a table and talk like adults, respectfully, and be treated like adults, respectfully, then we might as well just throw in the towel and get somebody else to do everything in this county. Because I have never seen anything in my whole professional life. I have never seen anything like this. And it is disgusting. That's all I can say. It is absolutely disgusting that people can't come together, make decisions, professional decisions. You don't have to like everybody. That's not our job. Our job is the community and everybody that works under our umbrella. The end. That's all I've got to say.
I would like to say something, please.
Go ahead, Paula.
Yes. I've been on the board for 1 year. The things that I have seen and heard are, like Shayla said, they're disturbing. They're disturbing. Seems like every meeting, we hear of things that are happening. The bottom line here, in my opinion, this is just my opinion, is people need to get along. Regardless of how you feel about somebody, be an adult and stop trying to turn everybody against each other. This is absolutely ludicrous that we are even here. Absolutely ludicrous. And one thing I would like to mention is, I know that there was a letter that was sent, because I was on it last week. And I want to ask the commissioners, is that the reason we're having this meeting? Is because you received a letter from dispatch basically saying that our chief is the problem? Is that why we're having this meeting?
No, you were,
So we're having this meeting because,
it was requested by the ambulance, not us.
no, not.
No, it wasn't.
I don't know. We're having this agenda item because there is apparent dysfunction with our services right now. And it is the board's, it is not our responsibility to step in and fix
Right.
the problem. It is the board's responsibility to create the framework where that problem can be fixed.
And we are doing that. But every time we come to this meeting, you guys berate us. We didn't do the voting. We didn't do this. And you know what? One of your commissioners was on the board. So to make this board feel like we've done something wrong, shame on you guys. Okay. This is a clear display of exactly why there's an issue. That's all I have to say. Thank you.
Thank you, Paul.
Can I speak? I do not feel, because we appointed the existing board, we have not felt like there was a problem.
After one of your board members, and several other people in the community trying to get somebody else to run for the board so that he could appoint his own board and run with it. And I know that for a fact.
And not only that, but Phyllis, you were the secretary. So if anybody should have known that there was a regulation for elections, it should have been you, and it falls back on you. My opinion.
And I totally own it, Paula, totally own it.
Good.
Because we did not cancel the election, totally own it. I even said I was on the board.
Right, absolutely.
I'm not aware of this. No, I totally owned it. You can ask Joyce or anybody. You can ask all board members, I owned it.
So basically going back to my point, sorry, I know I said I was done, but the sheriff and the head dispatcher do not like Damon, okay? That is a personal issue. So you guys need to stay out of it and let us handle it.
We actually had your sheriff come into one of our meetings, and I believe, if I'm not mistaken, Melissa, it was over a dispatching thing, wasn't it? Remember when he came to the meeting anyway?
Yes, it was.
He said some very derogatory things about our chief in the middle of our meeting. And I was on the Zoom and I said, Don, can you get any more rude? And he said, yes, I can. And I said, then you and I are going to have a visit after this meeting when I get home. And he's avoided me like the plague.
Is there anyone that would like to provide comment that hasn't already spoken?
I just think, I'm a person that, I mean, I moved back and, mom's, she's been with the ambulance for 30 plus years and donated, she's never got paid. She's done all this stuff. And, and I served on the board for a while and I've seen some of the stuff that goes on, but these entities in this small community, you have to find some common ground, I mean, so I only know hearsay. I don't have any proof. I'm not gonna slander anybody else. Like I've been slandered the last 3 years that I've been here, but without any type of proof, but we have to find some common ground because what's important is protecting the citizens and the community of Dolores County. It isn't how powerful you are or who you know or who you like or who you don't. If that's your person sitting there and they don't have the information they need to save their life, then there's going to be a problem. I mean, and it's going to be a big problem for Dolores County. I mean, for anybody that comes out there, we have to find common ground to work together instead of always trying to butt each other's head, one up this person. I have never seen anything like this in this small community. It's the first time I've ever been ashamed of living here. I grew up here and I'm ashamed the way people do each other here. It's crazy. And that's really all I have to say.
As a board member for a long, long time, I think it's actually 13 years. Doris, we didn't have any of these problems. It's been the last year.
Well, and no, there's always been a few
You're gonna have
problems here and there
bugs
because
and holes.
in the field, I mean, I don't even know how many years I spent on the field, in the field, but you'd get a call from somebody saying there was an emergency and they wouldn't give you enough information and you'd be digging for information while you're heading to this call because this is something that is so important in the MS world. When you get a call, the dispatch gets the call, we've had a fall and we need the ambulance. Okay. Do you know how old the patient is? No. Okay, if a 10-year-old falls and a 75-year-old falls, there's a huge difference here. We need to know age. Sometimes gender helps. Are they on any meds? These are things that most dispatchers should ask in the interim when they're taking a call. Because when we're headed to that call, I mean, we jump and run, we're getting stuff ready in the back of the ambulance. If a 75-year-old falls, you're thinking hip fracture, femur fracture, a number of things. What's their health concerns? Do they have heart health? Do they have lung issues? Do they have all this? A 10-year-old, he's probably gonna have a scrape, maybe a broken bone, but man, there's a huge difference in the treatment between a 10-year-old and a 75-year-old. So that's all we're asking is for some more clear communication when we're headed to these calls. You have somebody laying in the floor deceased in the bathroom. I can't even tell you how many calls I run on where we found somebody dead between the toilet and the tub. It just happens, and it happens in old people. It doesn't happen in young people. And you get there and you try to take care of the patient. You wait for the coroner to get there. You don't leave the scene till the coroner gets there. You always depend on law enforcement to help get the scene going, but you never mess with that scene. You don't let family clean up anything. You don't let anything like that happen until a coroner and law enforcement has said, okay, we're good here. There's just so many things in the dispatch.
But how would that have to do with the dispatch?
Because dispatch needs to let us know what's going on, and they need to stay in clear communication with family and EMS during this call, because too many times family wants to come in and take care of everything.
But to not get into too much of it, like I said earlier, we cannot solve all of those problems right in the
But I'm just trying to say,
our
this or this.
responsibility. Yeah, so, I mean, that there's a appropriate process for that to be hashed out, and I know that process needs to improve to the Emergency Services Council, because it does have to be unified for small areas between fire, the sheriff's office, ambulance, search and rescue, including the Ignor Fire. All of our operators in this area need it needs to be unified. All of that.
I
And
agree.
any of those issues that's where it needs to be looked at.
Mhm.
We
Do, just
can't
a
do that, and we
question,
don't want to do that.
do the dispatchers take formal training? I mean, do you have to do 40 hours of dispatching services or
Of course.
120 hours of
Oh,
dispatching services, or what kind of schooling do you take? I just am pretty
We
curious.
do 40 hours of on-the-job training, and then we continue using Police One Academy for our training.
I didn't know what kind of training you took.
And Joyce, as a dispatcher, you cannot control that family's gonna drag that person out and start CPR.
Oh, no, well,
I mean, you know
that's
that.
a complete different thing entirely.
Yeah, I mean, you can't say don't touch, I mean, they're,
No, but the communication factor is.
oh, I agree with that.
Well, one thing though, to make note of, as a dispatch, we only can give the information that we've been given.
We see.
And a lot of times we don't have enough information to give because that's all we've been given. We've been given incorrect addresses, wrong addresses. People say, get here quick, and they hang up the phone. You try to reach them back, they won't answer. I mean, and it's not just our dispatch, it's every dispatch. Like this page from Christmas was sent out by Cortez. It basically says someone yelling for help on 5th Street in the camper. He drives the town lawnmower. That was all the information the ambulance had to run, but that's all the information that dispatch was given. So it's not always dispatch's fault that we're not able to give you more information.
No, but there are ways to learn all that. We'll get into all that later at a later date.
Right. And that's all stuff that can be worked out, I think, in the proper forum.
So you used to have just one dispatch.
Well, Frank,
When you went home, Cortez took it over. That's the way it used to be when you was there.
They take over the 2257 number, the dispatchers take over the fire and ambulance. We're on call, or they are on
If
call.
they're not here, you can't have one at night that used to go to Cortez.
They still do.
Mr. Smith,
Yeah.
Mr. Smith, did you have your hand up?
I did, thank you. Good afternoon. I'm Carter Smith. I actually reside in your neighboring county over in Montezuma County. I am a constituent of the volunteer organizations and volunteer responders that are participating both in Dolores County and Montezuma County in a variety of locations. I have a very distinct privilege of being able to participate as a member of that constituency with the State Emergency Medical Services the State Emergency Medical and Trauma Services Advisory Council, known as SEMTAC. It's a Type 2 governor-appointed board that advises the CDPHE as they consider making rules. I was a participant in the development of the ground ambulance licensing rules. And as these rules were written and considered from a state level for implementation, there was a lot of consideration given for rural and volunteer organizations and groups that gave opportunity for them to improve, not even just opportunity, but time, support, and resources for them to improve and be prepared to meet the state level ambulance licensing requirements. As such, if you review the Grand Ambulance Licensing Rules in Chapter 4, you'd note that there are a few areas where there's an effective date of July 1 of 2026. Part of that is to help and support volunteer agencies and the rural communities as they try to overcome some of these issues, because it does require a great deal of growth in many areas to provide care and service to the populations that we serve. I will speak for myself in that I grew up in a very small rural environment. I'm very passionate. Though I sit in a neighboring county, my personal goal and passion is rural Colorado. And as such, I also participate in serving your community, putting my professional licensure on the line every time I come and serve in your community under a volunteer status. And I appreciate that opportunity every time I'm out there to serve the members of your community. I would ask you that, do the members of your community not deserve, I understand that there's cost implications, but do your members of your community not deserve around the clock EMD availability? EMD availability allows people to get resources there, and not just the resources to a location, but first aid and intervention by the lay bystander in the interim. Do they not deserve that around the clock? And I think that's one of the bigger pictures that has to be looked at here. Is this is for the betterment of your community. I don't think that there's a good or bad or right or wrong on any of this, other than those looking for the best interest of your community. And it would seem to me that providing those services around the clock are essential. Secondarily to that, I'm going to go back to myself and my own service as a volunteer. I have to maintain my professional credential to maintain my full-time employment. And again, working and serving in areas, I understand and willingly accept the risk that is associated with responding and taking care of underserved and difficult areas with difficulties like you're highlighting today. So I just, again, we'll step back here a little bit and say, I'm not going to advocate for or in behalf of a single agency or a single entity, but rather for the sustainability of volunteerism, the safety of the volunteers, both in their capacity as a volunteer and their other professional lives, so they can continue to support communities that they're passionate for, that they're passionate about, and the people that they're passionate about serving, while they also take care of their families and the needs of their families. So I would ask you also that you consider that the safety and consideration needed for your volunteers that serve your community, both from within Dove Creek or Dolores County and from those who come from neighboring areas to serve a population that we so significantly appreciate and love. Thank you.
Amy, do you have volunteers on the ambulance? Aren't they all paid personnel?
Technically, they're all paid volunteers. They're paid a stipend for their shift work that they put in.
Are they local?
There are 1, 2, 3, 4. Technically, on our roster, there's still 4 local providers. And I've been trying to recruit, but it's not the easiest thing, especially when.
Got a lot of money to go.
So
Yeah,
how many
and-
do you have from Montezuma County?
26.
Why?
Because they're the only ones that work.
They're trained, they're willing to come out here and work. And I mean, even the one of the individuals that's from Dolores County, is going through EMT class sponsored by us this semester. I mean, I guess here's my question to you. Would you rather have the ambulance covered 24/7? Or would you rather only have local providers responding?
I tried to have local if I can.
Why not both?
And I'm open to that.
I'm glad to
I
have.
am open
I
to,
don't think it has to be one or the other. I mean, if we're talking about improving the standard of care here, it should.
and I'm trying, but I can't send
So,
10 people through an EMT class.
I have something to say about
I think-
EMD.
I think we're here because of you, Damon. I hear a lot of not good stuff about you, how you're trying to pull everything out of the county, even Montezuma County.
Oh, that's a complete and total lie.
You are from Fort Montezuma County, now you're trying to pull dispatch that way. My suggestion is gonna be, if you're not happy with Orange County, maybe you ought to be in Montezuma County.
Well, that's good.
I have a question for you. Is you utilize
Real good.
your side that you represent utilizes Cortez 24/7.
Because there's a reason, the dispatch is here and they cannot just come through there, they have to go to Cortez and then it comes here.
So you think I should quit?
I'm just saying, if you're not happy in Duluth County and you're trying to make everything into Montezuma County, go over there.
All I-
Can I ask you where this is coming from?
I've heard bits of stuff here and there when I go around.
Yeah, I wanna know, I wanna know where, I wanna know facts. I don't wanna hear, oh, I heard it from so and so.
And I'm not gonna say who I heard it from, but I have heard. And I don't know Damon.
I kind of feel like, and
meeting.
Melissa's my niece, anybody that doesn't know that Melissa's my niece doesn't know anything.
Joyce,
Sorry, I'm gonna
there,
talk.
you've gone well over 5, so
Sorry, you're gonna talk and I'm gonna talk.
I'm just gonna cut it right there.
No, dear.
Because you've gone well over 5. Melissa,
We do provide EMD services through Cortez. Cortez does do EMD services for us 24 hours a day.
Mhm.
So if we get a call and it needs EMD Cortez, we transfer it to Cortez. So Cortez is available for EMD any time of day.
That's what I will say this, Carter's saying that we deserve, and if it's a 911 call, they'll start EMD before they even transfer the call.
And a lot of times they don't
24/7.
even transfer the calls. They just call us and say, we need the ambulance at this location.
And we've started
We are-
EMD.
Yeah, we have started EMD.
So Carter, that was, yeah, they do EMD.
We do have EMD 24 hours a day. It's just through Cortez.
And nothing has changed as far as, dispatch at night closing. Those phones still roll to Cortez. They had for, well, 15 years I've been here, and that's still in place. That's still happening, just like it always did. And then the fire ambulance phone is transferred to the on-call dispatcher every night. And the 2257, sheriff's office phone is rolled to Cortez. To make statements that we don't have 24-hour coverage, and that's been changed. It hasn't. It's exactly like it's been for probably since Phyllis
Since I've
started.
been 32 years.
Nothing's changed there.
Could I ask Keith something? Keith, can you hear us?
Yes.
Keith, can you describe, I know you and I have talked about this previously, but can you just describe the importance of keeping local dispatch services?
You know, anybody that's ever sat in on, after action reviews, communications is always the biggest problem. So expanding into multiple communication centers is just going to lead to more problems. The other thing, and nobody can tell me any different. You can argue with me till I'm blue in the face. I worked as a dispatcher for 5 years, search and rescue for 14 or whatever now. Cortez does not know where our addresses are. Probably 1 out of every 3 calls that are transferred to me for search and rescue by Montezuma County are actually in their county, not in our county. If when people are having stress and it still happens and they give their old address, or they're at their friend's house and they don't know their address, you lose that local knowledge to get people where they need to be. And I honestly can't see any way to say that we'd be doing any service to our people in our county. And you can, talk to some of the other areas who use outside dispatchers, outside dispatch centers. Montrose doing dispatch for Silverton, they don't know where anything is in in San Juan County. And it can lead to problems, and it will lead to problems.
Thanks, Steve.
I'd like to ask a clarifying question, if that'd be okay.
Yeah, hi, Danielle.
Yes, Danielle. Does Dove Creek Dispatch utilize Annie and Allie? Do they have phase 2 capabilities?
I know this.
No, we do not.
Okay.
Explain what phase 2 capabilities are.
So when Cortez Dispatch receives a call, we have Allie and Annie, which verifies both the caller's phone number, address, and gives a map location. Obviously, Dolores County is a little more rural, so when we do call out for those search and rescue missions, we do depend on Dolores County to know those hard locations. However, I'm also a Cortez dispatcher, so I know firsthand how this system works. So I do know that we have done our part as Cortez Dispatch to get that Allie information, which is the location, which is a map location, and Annie location, which is the number in which the patient calls from. Cortez, before we're even allowed to transfer the call to Dolores County or search and rescue, we have to have those 3 things as required by being a PSAP, which is the local answering point, which is what we are for Dove Creek as we answer their 911s in those situations.
Thank you, Danielle.
And Duck Creek does not have a CAD system, correct?
And
It's not.
I'm not arguing that information isn't being captured. What I'm saying is the times when we have a fire and an accident south of Gwines' hay barn on 6.7.
And then they hang up.
That's all I'm saying.
Well, I wouldn't know where that was. Me either.
Bizarrely, most of our dispatchers do.
And most officers know.
And when they don't, from personal experience, our dispatchers do.
I didn't know where it was. My fire department had to tell me when I was a new dispatcher.
So, I mean, to steer away from not trying to solve all of these problems right now as this board, like I said before, it's important that we create a framework where these problems can be solved. I feel like there are things that need to occur for both parties or all parties here. And with that, it would be a unified dispatch. Not saying that improvements don't need to be made, there are improvements that need to be made in every department, every organization, fire, sheriff's office, ambulance, dispatch. What our responsibility isn't to solve those problems, but create a framework where those can be solved. And with that, I mean, what our responsibility here as a board, I think looking at our resolution, I know it was brought up the July 1st license to operate. In that resolution 324-01, it was a resolution regulating ambulance licensing. I think an amendment to that resolution needs to be made requiring any ambulance operating in Dove Creek to utilize through an intergovernmental agreement the Dove Creek Dispatch Center when accessible. And I'd like that amendment. We could bring it up in another resolution for this year. Shayla, do we have a number?
It will be
What the next one? 12603. And the reasons for that, I believe that dispatch across all of our EMS providers here needs to be unified. And from personal experience and what I have heard and seen is that our local expertise is invaluable. We're in such a rural area. But the biggest piece of it is through that IGA, the process and procedure, anything that needs improvement has to be worked out through a effective emergency services council. And I see Keith on, I mean, that is the piece that has to fit with this, because that's where all of these problems need to be addressed. We can't throw the baby out with the bathwater and cut it here because things aren't getting done on that end. So that's my best way to create that framework. So I'll make a motion to amend resolution 03-2401, requiring any ambulance operating in the Dove Creek area to utilize through an intergovernmental agreement the Dove Creek Dispatch Center when accessible. And this amendment will be reflected in resolution 126-03.
Do you have authority to tell the ambulance service what they're gonna do?
Yes,
What's that authority on? What is?
for the license to operate, some kind of
That you come
stipulations
through
within that
no
license to.
Because of the bill, because of the election stuff? Is that the reason?
No, Robert, that's to do with the elections.
No.
I'm just trying to
Yeah.
understand how
I understand.
the Dolores County Commissioners have authority to tell DCAB what they're going, I mean,
So
to do.
I can give you a brief rundown.
Okay.
Back in 2024, when they enacted the state licensing of the ambulance, they basically removed, at the option of the county, they removed the licensing and took it in the state. And the state was doing the licensing unless the county chose to license ambulance services, so long as they met the regulations were minimally what the state provided. The county could add regulations to it. One of the regulations that was requested by the ambulance at that time was for exclusive territory. So the county granted that request and included in the regulation the exclusivity of the district's territory for their ambulance, which means no one else can operate within your ambulance district and ambulance. It also allows the county to add other provisions reasonably necessary, reasonable to the operation of the ambulance, and yeah. So
what is the purpose of the board if they can't make their own decisions then?
well, the board is an ambulance district, and
We're
there's
the
a tax.
governing body of the ambulance system.
I'm just
Yeah,
trying to
I
understand
remember
because
that going into effect. I was just trying to understand how it all.
No,
works,
it's-
'cause it doesn't
It's always
seem,
complicated.
I'd just like a clarification, this amendment that you're making
Mhm.
only affects the Dove Creek Ambulance District, not all entities within Dolores County.
Yes.
Perfect.
Well,
that's
if
not.
I could
that's not-
clarify that, you said the ambulance services operating in the county would utilize the Dove Creek dispatch when accessible.
Yes. Yeah,
So if
any
an
ambulance that's coming into our district will use Dove Creek Dispatch when
And
it's,
will you-
when it's accessible.
So for example, we know for a fact, just for clarification, we know for a fact that Rico Fire, or Rico Ambulance, whatever they go by. And why is that?
Why?
Because it's not accessible here.
Absolutely.
So,
The
right,
retail-
So and that's why I said yes to that, because I wasn't, I mean, we're not gonna require Rico to use Dove Creek when they are in Rico.
Radios reach across the state, sir.
The VHF doesn't transmit that far, Shauna. It's always was a glitch between with the VHF radio systems
But
to our base.
ambulance providers in the Dove Creek area will use our Dove Creek Dispatch Center when accessible.
Who will notify the agencies that responded to Dolores County of this?
I mean, if they're responding into our jurisdiction here, they should be going through our dispatch anyway.
I can tell you that Southwest will not transfer their radios over to here. And they run more than 11 calls within Dolores County.
I mean, how that coordination looks like, I mean, that will be worked out hopefully in our emergency services. Teams. So, a motion, did I hear a
Wait,
second?
I just wanna, okay, Chris, so this is the Dove Creek ambulance is what he's saying. To operate.
We're
Use
being
Dolores
singled
County.
out as an
Being singled
entity
out,
within
yeah.
the county.
No, you're Dove Creek ambulance, Southwest is not Dove Creek ambulance.
No, but
You're
they
Dove Creek
operate
ambulance.
within Dolores County.
Any ambulance operating in the Dove Creek area to utilize our Dove Creek Dispatch Center.
Which they do.
do you call them in?
Yep.
So you call, and we don't license them.
Well, I don't call
So-
them in. I call dispatch and your dispatch calls them in.
Yeah, so you guys have exclusive licensing in Dolores County.
And
With the exception of ambulances that are called in due to lack of
no.
availability and things like that.
even with that, those ambulances, if they transport more than 11 patients a year, are required to get a license within our county.
They're not required to get a license within the
Yes,
county.
they
They're required to get a license with the state, which gives them a license to operate anywhere in the state in a county that authorizes them to do so. If the county chooses not to do authorizations to operate, then any ambulance service licensed by the state is allowed to operate within that county. Dolores County chose to be an authorization to operate county and granted Dove Creek Ambulance exclusive authorization to try to protect your district and your income. And that's where we sit right now.
It doesn't address the other half of the county.
What doesn't address the other half of the county?
Rico does more than.
This
11.
resolution or amendment to this resolution does not address the other half of the county.
It doesn't need to address it, it's just the Dove Creek area. Is there any other
I
discussion?
think you gotta wait on that until you do some more research in that.
We have a motion and a second. Any other discussion?
I don't have any,
All in favor?
yes.
I'm a yes as well.
And Linda, I might add, for Commissioner Yeldon, sorry. You've obviously only heard one side of that story. I would love to visit with you about the other side of that.
When I heard those stuff and I started to look at stuff, I start looking at stuff and I take a lot of stuff in just by watching what's going on.
So do I. And when you can't get locals to work as our policies and procedures require, then they don't work.
And I just feel like he's just trying to pull Dolores County
And
up.
that is.
Far from that is a.
What I see.
I will also highlight that the rules, the Grand Ambulance licensing rules, do require certified individuals working on your ambulance. They cannot be, they have to be state certified and
Of
licensed.
course they do. Nobody's even questioning that. Everybody knows you have to be a licensed EMT to do it, work on the ambulance. Not 12.
So I see Keith on, I really think the next steps will be to work diligently, in communication with you and our, directors and chiefs
I'll tell you.
to bolster our emergency services council.
Who develops
I'm
that
visiting
council?
with you more about that, Keith, so.
Who makes up the council? Who says you're on the council?
I would imagine it would be any of our emergency services providers would have a seat at the table.
Yeah, and I think that an official formation of that would be awesome.
Necessary beyond awesome. Okay, do we have anything else?
Did Melissa, did you have your 5 minutes or did you want, or are we done with this? Where?
Nope.
Huh?
No.
Okay.
No other business.
Motion to adjourn the meeting,
I'll second motion to adjourn. All in favor of adjourn?
yes.
Yes.
Yes, is all.
I know. Now let's